For the battered but proud people of the Empire State. From the financial and entertainment epicenter of New York City to the sleeping and empty small cities and towns of upstate, which once bustled with manufacturing, mining, and farming. We all know from inspiration, history, and nature, we deserve a return to the success and growth of generations past, a birthright being squandered by corruption in Albany, and the depredations of an insecure, scheming mountebank posing as governor, who loathes both us and himself. As liberty beckoned to enslaved peoples behind the Iron Curtain via American broadcasts after World War II, we now say, believe, rise, and join us. Welcome to Radio Free New York.
Hey guys, welcome to Radio Free New York. I'm your host, Andrew Hollister, streaming to you from the Liberty Studio, and I've got Bob Savage with me as well.
Here in the Battling Totalitarianism studio.
There you go. Bob, it's been a while. I'm used to talking to you like 4 or 5 days a week, and I missed you a couple days. So
I know.
feel like
well, you know, you're hiding in this this bunker that nobody knows where it is, including me. So I guess it's I have to wait for you to reach out.
Yeah, there you go. Yeah, we're nestled safely in the city of Rochester on the Gates border. So whether or not you consider that safe, I guess, is going to be a matter of opinion.
Yeah, if you want to be part of it, you're going to have to narrow it down a little bit more than that.
Yeah, absolutely. So welcome to Radio Free New York. Today we've got another topic that I think just doesn't get talked about enough. And I didn't even think about discussing it until a conversation came up over the last couple of days, and I was like, you know what, we should have this conversation on air. We should be talking about this issue. So let me first welcome you guys to joining the conversation. You can do that if you hop on one of the social media platforms. You can jump on Facebook or YouTube, search Andrew C. Hollister. Pull up the live feed right there, and you can comment. It'll come to my screen here, and I'll read it between breaks. Or you can call us live here on the radio station, and that number is 585-346-3000. Once again, it's 585-346-3000. So as we're talking here, you might want to jump in on the discussion. I definitely encourage it. What I want to talk about today is why Americans should choose to pay their doctors in cash. And when you hear that, you might be thinking, what do you mean, Andrew? You mean I can't use plastic anymore? I can't use a check? And that's not what I mean. What I mean is as opposed to insurance. And we're going to talk about this, but I truly believe that the reason healthcare has gone downhill in this country and the quality of care has a lot to do with how we've interacted with insurance companies and how we've allowed the insurance companies to monopolize our care that we receive from our doctors. So that's the premise. That's the beginning of today's show. The other thing we're going to hit on today is an update on the Sanctuary County Ordinance in Monroe County. So if you're not aware of this, if you haven't heard about it, there was legislation submitted by Gun Owners of America and Monroe County to the county legislative body to make Monroe County a sanctuary county for the Second Amendment. There's some cool stuff about this. I've got a brief outline of the legislation submitted. I've got a call to action for you guys. We're going to talk about all of that later. But just in case you don't make it to the end of the show for some reason, I will give you guys the date, time, and location that I'd like you guys to show up. That is going to be at the county building, March 10th, 6 p.m. The address there is 39 West Main Street, and it will be on the 4th floor. So let me give that to you again. Get your calculator, get your calendar out or a notepad or something. It's March 10th. 39 West Main Street, 4th floor, 6 p.m.
County office building.
County office building, yep. So what I'd like to have you guys do is show up that night in support, and if you feel so inclined, reach out to the county legislative office. I don't have the number with me, and sign up to speak. You technically can get 2 minutes to speak, and you can talk about whatever you want. I would hope that, you show up and you talk about why we need to protect the Second Amendment in Monroe County. But you can talk about whatever you want, I guess. But the idea is to get a very big, strong showing there so the legislative body sees that the people of Monroe County want this, support the Second Amendment, and think that Albany really needs to get their nose out of our business and, by extension, New York City. So that's that little plug there. We're gonna talk more about that later in the show. But first, I want to share with you guys a brief story, and each of you may have encountered something similar to this, whether with a friend, a family member, or you yourself experienced it. This is a conversation that took place a couple days ago. It was with somebody close to me. They were with their doctor, and the doctor said, based on the problems you're having with this condition, the diagnoses you were given, the treatment that you've tried, I really think that for your health to be successful, for your treatment to be successful, for you to have a recovery, that you need to try this alternate route of treatment. And then the doctor kind of stopped, took a step back, and said, "Oh, but you know what? It's not going to be covered by insurance." And the doctor kind of stopped there and thought, "That's the end of the discussion. If it's not covered under insurance, then you aren't going to be able to move forward on this treatment, and therefore it's just not an option." And this person spoke up and said, "Well, believe it or not, I actually don't have insurance." And the doctor was fairly surprised, although they probably shouldn't have been because they were cash pay with the patient, and said, "Oh, you know what? Let me check. Oh, that's right. Yeah, you don't have insurance. Then let's move forward on this. Let's make this happen. Let's do this. I want to refer you to this place and this provider for this type of treatment plan." And it opened up the door for the potential treatment of this person, for something that their doctor truly believed is what was necessary and what needed to take place for this person to get better. So why do I tell you guys this whole story? The first piece is because it was surprising to a doctor that somebody didn't have health insurance. So we're going to address that a little bit later, but I want us to think about this, that you know enough people have health insurance that when they are in front of a doctor, the doctor just assumes that they have health insurance. And the second piece is that by having that health insurance and the doctor thinking that they had health insurance, they automatically assumed that the correct treatment path that they wanted to provide the patient just simply wasn't an option. They they basically sat there and said, "Oh, it's not covered by insurance, therefore you cannot pursue the treatment you want." And then the third piece here is how that entire scenario changed when the doctor heard, "Oh, you're self-pay. You're used to paying for your treatment, with cash, essentially, without an insurance being the in-between in the prevention of your care. Yeah, okay, great. Now we can actually pursue the right path of treatment because that barrier doesn't exist."
There's
Um,
all kinds of case histories like that. Like there's somebody I knew who had a condition, needed an arthroscopic procedure. The deductible on the on his health plan, combined with the copay, was going to be $23,000. The doctor agreed to do the procedure, private pay for under 10 grand.
yeah, yeah.
So the
And
total
that's
procedure, the real cost of the procedure, was less than half of the copay, which
yeah.
tells you a lot about what government-run healthcare is going to cost.
Oh, absolutely, absolutely. And that's, I have a similar story for myself about, I think it was 5 years ago or so. I got into a small motorcycle accident. Low speed and everything, but I was beat up pretty good. I was missing a lot of skin and a few other things. Had some shoulder damage. Went to my doctor's office, and we had one of those, $6,000 deductible healthcare plans, or that's what we had the year before. And so the doctor thought I had that same insurance. They're like, oh yeah, it's gonna be like $600 or $700. I go in there, I was cash pay. They're like, oh, it'll be like $180, and they include a tetanus shot. So I mean, it's just a vast difference between cash pay versus insurance. We're going to talk a little bit more about that after our break here. You're listening to Radio Free New York. We'll be back in a moment.
Your business relies on computers and technology to operate. Slow, unreliable networks and servers can cause unplanned downtime and affect your bottom line. The experts at SimpleTech Innovations are here to help. Their preventative maintenance program ensures that your computers and network are kept up to date and monitored for any issues, keeping your business running smoothly. They also help clients achieve HIPAA, PCI, and New York State cybersecurity compliance to keep your network safe and secure. Whatever your business IT needs are, SimpleTech Innovations should be your first call. They've won the Best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. Call them today for a free consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
If you're looking to market and grow your business, make new business connections, and give back to the community in a meaningful way, consider joining the Greece Regional Chamber of Commerce. We're the largest suburban chamber in Monroe County, and we offer networking, education, marketing, insurance, and advocacy. You do not need to live or work in Greece to join. Our members come from throughout the region. In short, we're better together, and together, we're moving business forward. Visit greecechamber.org or call 585-227-7272 to join today.
Tom Walls started in 1955. Since then, America has been through wars, natural disasters, and economic highs and lows. Rochester companies have had their ups and downs, but one constant, Tom Walls. Tom Walls has stood the test of time. A Wahlburger and a frosted mug of root beer on a sunny afternoon brings us closer to our past and reminds us of what is good. My name is Riley. I am Tom Walls.
Share the good times. Tom Walls.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the Best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
You're listening to Radio Free New York.
And we are talking the real cost of healthcare with, of course, your host for the most, Andrew Hollister, broadcasting from the super secret location somewhere up on the northwest side someplace.
Somewhere. Yep. Nobody knows where. No, I'm in my office over at SimpleTech. So those cool SimpleTech commercials you guys hear on the radio waves, that's my office. That's my daytime job. And I've got a nice little setup here so that I can reach you guys while taking care of my customers and kind of take care of things in between. But yeah, so today's conversation is about essentially how health insurance, gets in the way of your care. And truly, as you look at it, health insurance becomes the middleman for your treatment. And I think this is just a really bad thing, and this kind of popped into my mind. I shared a story at the beginning of the show about how I had somebody close to me who went to the doctor, and the doctor said, oh, you should really do this treatment plan, but it's not an option because it's not covered by insurance. And then when they found out that patient wasn't tied to insurance because they were self-pay, then that treatment option opened up, and they had the ability to pursue the treatment that they was important to them, that the doctor truly felt was the right way to go. So the reason I bring this up is because there's a number of issues that I see in the healthcare industry created by insurance. Now, am I saying insurance is bad, terrible, and evil? I'm not saying that people shouldn't have the option to purchase insurance if they find value in it, if they truly believe it's going to be good for them. What I am going to say is I think the way we have insurance today in the United States is actually bad. There's a lot of negative side effects. And one of the reasons for that is it is a forced mandated purchase. You have to buy this insurance. Therefore, customer service doesn't matter. Quality doesn't matter. It's something that you're forced to do. Why would they bother being good?
Well, if you pull on the string a little bit, you find out that really the function of insurance is to act as a surrogate for government. And the purpose of a lot of the insurance expense is to pay for government regulation of the healthcare industry. And of course, that all gets passed along to the end consumer, you, because you have no idea what the real cost of your care is.
Yeah, no, absolutely, and that's actually one of the things I have in my my pros and cons column, if you will, for self pay or cash pay, is your ability to not only negotiate the rate of your care, which is if you have insurance, forget about it, that's not an option, but also to know transparently and most of the time up front exactly what the fees and the costs are going to be. So it's predictable. You know what it is. When you go with insurance, you have no idea what the costs are going to be.
Right.
The doctor can't tell you what the costs are going to be. And yeah, they bundle in all of these things that you don't know what they mean and what they are.
Yes, the total cost of your care, your health care, is completely removed from your decision-making process. That's all made for you. So what you have is you have a situation where, for you and your family, you want coverage. Whatever it is, whatever happens to you, however sick you get, whatever accident you get in, you just want it to be covered. Well, that's all very well and good, but that also enforces a certain kind of forced ignorance on you about what the true cost of your insurance is. And if you made informed decisions, you would probably pick better options, you'd get better health care, and you'd spend less money.
Yeah, no, absolutely. And I did some research a couple weeks ago. I don't have it in front of me, but if I recall, the average cost of healthcare in the United States for a family with one child is something over $10,000 a year. And that's usually coupled with a high deductible plan of anywhere from $3,000 to $6,000, which means the average family could be paying as much as $13,000 to $16,000 out of pocket before their healthcare coverage, their insurance coverage, even kicks in. And then when that coverage kicks in, you have no control over it. You don't even have a say in your treatment path, because all the insurance company has to do is say, we're not covering that until you do 6 months of this other treatment path that the insurance company decides. Not even your doctor, the insurance company decides. And you spend 6 months not getting better, and 6 months maybe getting way worse. Now, 6 months later, not only do you still have your original problem, but now you might have other problems and complications and side effects and symptoms that have come up from a treatment plan that your doctor never believed was going to work for you anyways. So it's just a bad system. But let's talk about some of the things that that I think would be really positive if we were able to switch the system to self-pay and have a large scale of Americans move themselves to self-pay health care. Right now we have health insurance. It's really funny because you hear a lot of the Democratic candidates especially talking about we need universal health care. Well, isn't that what Obama said that we had with the Affordable Care Act, that was universal health care?
Well,
Would everybody...
Yeah, no, I think when they're talking about that, I think they're talking about Medicare for all, which is different from Obamacare.
No, it totally is. But what I'm saying is, if you listen to what they say, they keep saying the same thing. We need universal health care. And then they passed what they said was universal health care then. Now they're saying again, we need universal health care. This time it means something totally different,
Yeah.
but they're using the same messaging. In reality, and it's very important that we differentiate this, they're not talking about health care. Obama was not talking about health care. Everybody is talking about health insurance.
Health coverage, right.
Yeah, exactly.
Yeah, look at the state Obamacare program, Fidelis Care. What do all the billboards see? What do you see on the bus cards and the billboards you see around town? Let's get everyone covered.
Yep.
Not let's get everybody healthy. It's not like let's get everybody cared for. No, let's make sure that everybody is covered.
Yeah.
So you got to be careful about the weasel wording when stuff comes from government.
Yeah, no, it's really important. And even when they report on how successful the Affordable Care Act was, they didn't report on how many people were healthier. They didn't report on how many less surgeries needed to be performed, how many fewer people were obese, or any of that. What they reported on was number of people covered, number of people with health insurance, not people who became healthier because of it. So this is really important. You guys need to be able to see this and share it with your friends and show them. And I know some of you guys definitely know this already, so I don't want to beat a dead horse here. But I want to make sure that we're always paying attention to the language because it's so important. Because politicians make promises with very specific language, and then later, and they allow you to assume that they mean what you want when they know that what they're saying is not what you want, but they'll let you believe it is. And then when it comes to the time where you say, hey, this didn't happen, they go, no, we didn't say that you would be healthier. We just said you'd have coverage. You
Right.
have coverage.
And here's one reason why we're worse off, and one of many reasons why we're worse off than we were before Obamacare. And that is that prior to Obamacare, every hospital had a mandate that said you can't turn away anybody who comes in and needs health care. So people would get treated in the emergency room at the hospital. But of course, because we knew there was going to be this big influx of illegal aliens who are going to use basically the emergency room of hospitals as their primary physician, that had to be addressed. So now what we have is coverage as opposed to, everybody had care before. We had care. It was fine. But now we have to have coverage, which is staggeringly expensive and bewildering to use.
Yeah, no, it is. And if you speak to your doctor, I would actually challenge you guys to do this. So next time you go to your doctor's office, I don't care if it's your dentist, your primary care, your podiatrist, your chiropractor, whomever, go ahead and ask them about a couple procedures and say, what is this going to cost me with my insurance? And they'll scratch their head a little bit, maybe reach out to their billing department. Somebody's going to have to call you back in a few days.
They won't know.
They won't know.
They'll have no clue.
They'll have no clue. And if you actually do those procedures, I guarantee you, almost 100% this is going to happen. The price they quoted you is still going to be wrong. It'll still be wrong.
Yeah.
You'll still get some weird extra charge from your insurance company that you weren't expecting. It'll happen. Now, in that same discussion, ask them, if I was self-pay, what would this cost? And they will be able to give you a fixed dollar amount or a ballpark range that is guaranteed to be the actual cost of that care. And that's the difference. Knowing and having the ability to have this answer up front and transparently what your care is going to cost versus some intermediary middleman who's negotiating rates and other services in the background that you know nothing about. And it's so complex and so confusing, even your doctor's office can't figure it out.
And also understand, too, that under a scenario like Medicare for all, as Bernie Sanders would say, private pay options would be taken off the table. That would be punishable as a criminal offense. So that's what the presidential contenders on the left have in store for you.
Yeah, and we'll talk about that when we come back from the break, because we're going to talk about other countries that have a system just like that. We'll be back in a moment on Radio Free New York.
Now, more than twice the power.
WYSL.
More powerful FM 92.1, FM 95.5 West, and 1040 AM WYSL Avon Rochester.
Here's the latest forecast from the News 10 NBC Weather Center for tonight. Lake effects, snow flurries and showers will taper off, and then we'll have clearing skies. Cold out there. Temps will drop down around 10. For Friday, pretty good day, maybe a bit of a breeze in the afternoon. Sun and clouds will be up near 30 for a high. The weekend's looking really good. Saturday, we'll see some sunshine near 40, and with fair skies on Sunday in the mid-40s. I'm Rich Cordelia, WYSL.
It's here, the biggest President's Day event in town. And it's all at Patrick Buick GMC. Everybody's picking Patrick, your exclusive truck and SUV dealer. Choose from all kinds of GMC Sierras, Yukons, Acadias, and Terrains. And now the all-new Buick Encore GX, plus Envisions and Enclaves. If you want an SUV or truck, Patrick has access to over 1,000 of them. Here's more reasons why everybody's picking Patrick. 35 years in business, over 3,000 five-star online reviews. And we just increased our rebates, added Auto Show bonus cash, and lowered our lease payments. See everything at PatrickBuickGMC.com. It's our annual President's Day event. It's all over March 2nd. Patrick, we are professional grade. Corner of Lehigh Station and West Henrietta Road. Don't miss Patrick's President's Day event and see why everybody's picking Patrick. Patrick Buick GMC in Henrietta.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
At last, education for your pre-K to high school senior that honors your traditional values, including classical instruction of essentials, a family-friendly environment, small class sizes, and school that's Common Core free, patriotic, and Catholic faith-based. Meet Archangel School in the town of Gates, where tuition is affordable and parental involvement is welcome. From Section 5 sports to a champion robotics club, there are many challenges to experience at Archangel School. Come to Open House on Thursday, March 12th from 6 to 7:30 p.m. Visit archangelschool.com or call 247-1112.
Has your favorite pizza place been letting you down? Try Livingston County Pizza Company and Gluten-Free Bakery in Avon. Not only is their pizza amazing, but their full menu and bakery has something for everyone. Livingston County Pizza Company and Gluten-Free Bakery, Avon.
The Rochester Lancers are home Friday, February 21st and Saturday, February 22nd. Remember, it's a party, not a game. Get your tickets at ourlancers.com. Bring your team, bring your group, ourlancers.com.
Open Door is a great place because it helps you with your whole self. It's not just about the addiction. And I can't think of anywhere else I would want to be to do that. It's safe, it's challenging, but it works.
Go to opendoormission.com.
Avon Gun and Hunting Supply, a locally owned and operated gun shop specializing in pre-owned firearms and repairs. Get your rifle, shotgun, or pistol serviced and tuned before you take it to the field. Open Tuesday through Saturday, Sunday and Monday by appointment. Avon Gun, East Main Street, next to the Bank of Castile.
You're listening to Radio Free New York.
Kind of a snowy old day, and we welcome you in here to Radio Free New York. Shout out to our friends along the WYSL network. That would be WENY, The Patriot, 1230 and 1450 in Elmira Corning. Also 106.9, was it 96.1? And 103.3, I think, in Horseheads. really need to look those things up. Then, of course, WACK up in Wayne County, where they're getting hammered with snow today, 1420 AM and 96.9 FM. And your flagship, the WYSL stations. Here's Andrew.
All right, welcome back to Radio Free New York. We are talking about actually having health care, not health insurance, and how self-pay allows the doctor and the treatment path to be something that is closer to the patient, between the doctor, without the insurance company getting involved in directing your path of care. And I do have a comment here on YouTube. I can't see the name, but this person says, as a physician, I find the current system terrible. It discourages preventative care and definitely disincentivizes medical students from going into primary care. And yeah, that's like a terrible thing, right? We want students to be the best doctors that they can possibly be, and we want our doctors to look at us, look at our bodies, look at our health, and say, how can I prevent bad things from happening? How can I help you be the healthiest you can possibly be? Well, insurance doesn't look at that. Insurance doesn't care about that. They care about giving the least amount of exposure and risk as possible. And if you do have an issue that comes up, repairing it in the way that the insurance company deems is the most cost effective for them, which is not always, I would even venture to say, that is most of the time not in your best interest. And not just that, when you pay with insurance, the doctor's offices have to jump through a ton of hoops to get paid. I'll give you an example. There's these procedure codes, CPT codes, for example. In order for your doctor to get paid, they have to submit what procedure was done, and it's got to be coded properly. Not only that, the procedure code isn't enough. They need to associate a diagnosis code with it, an ICD-10 code, so that they can get paid. If those things don't line up right, or if they mismatch, or the insurance company says things are in the wrong order, guess what? They deny the claim, and that claim could fall back on you. But 9 times out of 10, the doctor has to pay a staff member to go through, figure out what the issue is, recode it, resubmit it, and it can take anywhere from 30 days to 90 plus days for the doctor to get paid for your visit. And what does that mean? That means that technically doctors' salaries and doctors' offices in general, they're kind of running on credit, because they're running and operating on money that they're hopefully going to collect in the near future from the insurance company, but there's no guarantee that happens. And then they try to turn doctors into collection agencies if the insurance doesn't pay. So this is a problem. Whereas if you cash pay, if you self-pay, if you show up and the doctor says, yeah, we got to do this treatment, it's going to cost you $250, and you pay for that up front, the doctor doesn't have to pay an administrative staff, a billing staff, a medical coder, and in some cases an insurance specialist, depending on how big the office is and how they're structured, to handle your insurance claim. This is what it is. I mean, imagine you get into a car accident and you file a claim for reimbursement. That's essentially how your body and your health is being treated. Oh, you got sick, that's an accident, we're filing a claim for reimbursement. So they have all these specialists that have to work for the doctor just to try to get paid for that maybe 15-minute visit that you spent with the doctor.
Which is why the argument about from Obamacare about how we're going to bend the cost curve down, we're going to actually save you money on your health insurance, is ridiculous. It couldn't possibly have happened. You can't erect a gigantic federal bureaucracy to administer health care and have costs go down. It's just not going to happen. By the way, breaking news, by the way, just want to toss in here. Roger Stone, Trump advisor, sentenced to 40 months and $20,000 fine. So 3 years.
$20,000, huh?
3 years and 4 months.
Yeah.
And I'm sure he's in the clink now, I think, isn't he?
I thought I heard something
free?
About that. I'm not really.
Says he's
sure,
not in New York State. He's free on bail, but maybe. But yeah. So a little difference there between the what the Justice Department wanted to whack him with, which was 9 years. He got 3 years and 4 months. 40 months.
So, as we talk about this issue, I think that it's really, really important to point out and to reemphasize what Bob just said about how government will only get bigger if we shift health insurance to the government. Government will get bigger, bureaucracy and red tape will only increase. But here's the other thing. It's going to cost more. It already costs a tremendous amount of money. And if you self-pay, there's no hoops for the doctor to jump through anymore. They don't need a bunch of medical coders, billing staff, special agencies to handle their claims, clearing houses that they pay for. All of this stuff costs money. It's passed down to you as the patient. They don't need that anymore. The cost of healthcare then comes down to the cost of healthcare. Right now, you're not paying the cost of healthcare. Right now, you're paying the cost of like your actual care, and then all the other stuff.
Administration, yeah.
Yeah, the administration. And it could be as simple as, simple clearinghouse fees are monthly subscriptions that doctors have to pay anywhere from $150 a month to $400 a month just to have the access to submit those claims. So all these extra costs are being built into the cost of your care, and you're paying for a significantly more amount of stuff that really does nothing for your care. The other thing that's really important when you switch to self-pay is, and we emphasize this a little bit, is your choice in your care comes back. You don't have insurance directing what treatment path you want to take. You have your doctor saying, this is my advice to you for you, and I think you should take it. But you also then have the option to say, you know what, I don't think that treatment path is right for me. I want to take this other treatment path. And you and your doctor might disagree, but insurance isn't in the way anymore. And your doctor can talk with you confidently about the pros and cons versus just saying, well, that's not covered by insurance, so it's not an option. So it's just another way to give you choice, to give you the ability to have a say in what happens with your body when you're sick. The other thing that I think is really important to emphasize here is that government becomes accountable to people. Yeah, we're still hoping for that. No, the doctor becomes accountable to you as the patient instead of accountable to the insurance company. So once again, that changed. Since you are directly paying your doctor, they become accountable to you, not to somebody else. If they had to chase for money, they're chasing you, not somebody else. So the care will just get consistently better. The other thing that I think is really, really important is how people shop for doctors right now. So right now, say for some reason you need to find a doctor, whether it's a primary care physician or somebody else. How do you shop for a doctor right now? You shop based on who's in your network, who provides coverage. Very few people have the ability to say, who is the best, who shares my philosophies on treatment, who aligns with my principles on care. No, it's always, well, which doctor's in my network? Which doctor does my insurance company cover? This and that. So the idea of patients reviewing doctors and their care is kind of irrelevant in today's market. But if you switch to self-pay, the doctor being in your network or not doesn't exist anymore. So now when you leave a review in a self-pay world that says, Dr. So-and-so was a phenomenal doctor who spent all the time I needed listening to my needs, who truly cared about me, and offered a solution that I believe really helps me, that review carries weight. And on the flip side, Dr. So-and-so spent 2 minutes with me, they poked me twice, left the room, I never saw them again, I don't know what my treatment plan is, and I wasn't listened to, that also matters. So bringing self-pay back to healthcare makes it so that reviews and things like that truly have a say in what doctor you choose. So, sorry guys, I couldn't tell if the music was playing. All right, so we're going to take our last break of the hour. When we come back, we're going to talk very briefly about how all this could change if Medicare for All passes. We'll talk about that and more on Radio Free New York.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
Aircraft Environmental Systems proudly supports Radio Free New York. Rochester-based leaders in climate simulation chambers for America's R&D laboratories. We're experts in troubleshooting, calibrations, custom designs, and consulting for more than 40 years. Industry pioneers, we created the first ever fleet of temperature, humidity, and altitude test chambers available to rent coast to coast. Trained and trusted by environmental chamber manufacturers, we are ACES. Find us at acesinc.com.
Human trafficking is when someone is being forced, tricked, or coerced to engage in a sex trade or forced labor. If you're a kid and forced to sell sex, drugs, or work against your will, that's trafficking. You're not a criminal, and there is help available. Call the National Human Trafficking Hotline at 888-373-7888 or text Be Free. Sponsored by the Livingston County Safe Harbors Human Trafficking Task Force.
Your business relies on computers and technology to operate. Slow, unreliable networks and servers can cause unplanned downtime and affect your bottom line. The experts at SimpleTech Innovations are here to help. Their preventative maintenance program ensures that your computers and network are kept up to date and monitored for any issues, keeping your business running smoothly. They also help clients achieve HIPAA, PCI, and New York State cybersecurity compliance to keep your network safe and secure. Whatever your business IT needs are, SimpleTech Innovations should be your first call. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. Call them today for a free consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
Radio Free New York.
And once again, kind of a snowy day here throughout the Empire State. We have Andrew Hollister.
Yeah, welcome back to Radio Free New York. So we're wrapping up the discussion here on self-pay and how that could make our healthcare system way better, how insurance is really just making it hard for you to get the care you need from your doctor. And one of the things I was hoping to cover today, but we're not going to have enough time to, is the Sanctuary County Ordinance for the Second Amendment in Monroe County. So before I continue on the discussion, I just want to give you guys the information so you have it. What we're looking for is for people to show up March 10th, 6 p.m. at the county office building. That's 39 West Main Street on the 4th floor. Once again, that's March 10th, 6 p.m., 39 West Main Street, 4th floor. We're going to talk about this more tomorrow in terms of the status of the Sanctuary County Ordinance, the details of it, what's included in there. But I just want to make sure you guys have the information, put it on your calendar now so you can make it to that event. So as we're talking about this discussion, something is important to discuss, and that is what happens, how does this system change if we actually end up with Medicare for all? And I didn't get a chance to watch the debate last night, but I'm pretty confident that if healthcare came up, there were probably candidates saying, oh, we need to switch to Medicare for all, and this is going to fix our healthcare problems, even though we all know every time government gets involved, it gets worse. But, you know, who cares? I guess we can't learn from our mistakes, right? So I want to share with you guys something that is already kind of giving us some foreshadowing and showing us what will happen if Medicare for all passes. Right now, the regulations and the process, the hoops that medical offices have to jump through to collect their payments and their reimbursement from the insurance companies is so difficult that they're struggling to survive. It's just a reality. Because of that, you see large conglomerate medical organizations like hospitals and medical groups buying up private practices. That is what's happening. You've heard some of these companies say things like, we're going to eliminate the private practice. I think there's like 6 major healthcare providers across the United States right now, and they are just buying up these private practices that cannot survive. They cannot get by because they just don't have the manpower necessary to keep up with the regulations and trying to get reimbursements. Why do I tell you all that? Well, because this is an example of big organization and how it would look with big government taking over. These big organizations, they're taking over. Guess what? Did your healthcare get any better? Are you getting any extra time out of your doctor with these changes? Do you feel like they're being more responsive? Do you feel like you have more say in your treatment plan? No, the answer is no to all of these questions. So if government does take over and government creates Medicare for all, it's not going to fix care. It's not going to give you say in your treatment. It's not going to bring those costs down. That's simply not happening. And we have real life, real world examples happening here in New York State every single day. They're showing us that. Government's not going to make it better. And here's the best part, and by best part, I'm being sarcastic. What you're going to have is the doctors will still not be accountable to your care. There's still going to be some middle person who controls your treatment plan and says, oh, sorry, that's not covered.
Yeah.
Sounds like we've got somebody on the line here.
We do, yes. Let's see, it's Ryan from Rochester. Hey, Ryan.
Hey, I heard your segment, and it just sounds to me almost like a bit of a dystopian viewpoint, where you pay directly. I just imagine elderly people and children, that are actually sick, not being able to pay for their insurance, and people going into bankruptcy, people having their cars taken away. That just doesn't sound right. I don't know how you can explain it, because the $200 to go see a doctor for a 15-minute visit, if you have stuff he knows, that's one thing, but it just doesn't seem to account for the inherent inequity, that you would have. And, I was in several economics classes in college, and we did a lot of games, simulations, where we would just test different theories with the insurance market and where the money went. And for sure, the more information that the insurance companies get about you, the more money they make. That's always the case. And the only way to have any equity, even whatsoever, in an insurance market is to have regulation. And you can go to any economics class and learn that.
Hey, Ryan, let me stop you for a minute. So you're saying that the insurance companies represent a monopoly?
Sure, yeah.
Okay, what's a bigger monopoly than that? Government.
Well, no, the government, they're able to regulate it, because if they don't have regulations, they can extort you. They can take advantage of you. They can do whatever they want, No,
what happens is in the free market, Andrew, just jump in here anytime you want. What happens is in the free market, if they extort you, if they overcharge you, some other insurance company, or a healthcare provider comes along who provides the service at a fairer price, and then they win. See, that's the way the fair market works.
And one thing I definitely want to point out here is I hear what you're saying, and I want to address that. People are already going bankrupt with healthcare costs.
Right.
That's already happening. People are already paying $12,000+ a year for really crappy healthcare. So the idea that somehow we've addressed this or fixed this, it isn't true. And we could even look at something like, a great example I've got is Spain. Right now, Spain probably has the best healthcare in the world in terms of treatment and stuff, and they do follow a government subsidized model, right? They still have private practices. They still have private medical doctors. And when I went there, everybody's like, oh, the healthcare is so good here. The government pays for it. And it does cost them a lot of money. Private practice didn't go away because people are still choosing to, even though, and I'm using air quotes here for those of you listening to the radio, but even though they have quote unquote free healthcare, it's one of the best rated systems in the world, people are still choosing to take their money and spend it on private practices. So I don't see any way that private practice is going to go away, and those people are all choosing to self-pay because it's a model that's better.
No, I don't agree with you on that. I don't think that it's very equitable, and I think that there's a lot of people that are left out under that plan. We live in the U.S. We've got a free market. That's a great thing. People are capitalists. I don't anticipate, no matter what we do, that the private market would go away with healthcare. But you can't expect to have, any amount of equity if there's not some kind of a safety net, if they don't group people into categories. I think that the kind of protection.
And one thing I want to jump in on is there will always be a safety net. There will always be a safety net.
Yeah, it's called competition.
And not even that. There's always going to be nonprofit organizations and agencies that get together. We've always had that. There are organizations in every corner of the United States who look at this and go, hey, somebody can't afford this. And there's private industries that do the same exact thing, that say, hey, we recognize that people can't afford this. We're going to step in and help that, whether that's charity through the doctors themselves, through medical organizations, communities, churches, schools. I mean, you name it. That has always happened in the history of the United States, and it will continue to happen. And I know you mentioned we have a free market. Right now, we don't. We have a closed market system that is heavily regulated and takes away free market choice. That's why we're having these issues. And I'll tell you, every doctor who I speak with, I work very heavily with doctors and medical billing specialists, which is why I know so much about the topic. They all say the same thing, that this system takes away choice from the patient and doesn't give them a way to properly care for the patients. So I know that you say you disagree. We're going to have to agree to disagree on here, but I don't see any way in the United States, if we allowed people to have actual say in their care and their treatment and pay their doctors directly, that we would also allow those who are less fortunate to not get access to care.
Thanks for the call, Ryan. Appreciate it. And we got to wrap it up here, Andrew.
Oh, yeah, we're at the end of the show. All right. Well, guys, thank you so much for listening to Radio Free New York. Tomorrow I'm going to cover the Sanctuary County Ordinance in Monroe County, so make sure you tune in, same time, same place.
You're going to have wacky Kevin Wilson in here again tomorrow?
Kevin will be here, maybe even Sean. We'll run some Fake News Friday stuff. We'll have a good time.
All right. Thanks for joining us for Radio Free New York. We'll see you next time. Drive safe.
It's a great time to shop at Victor Chevrolet.